Welcome back to Sunrise Daily. Well, yes, as you may have seen in those reports, some of the health challenges which is being reported in Katsina and in some other parts of the country. That is what we're focusing on starting with today on the program. So we do have Dr. Chikwe Ihekwazu here with us. He is the Director General, Nigeria Center for Disease Control. Thank you for coming on this morning.
Thank you very much.
Well, already we see some sort of confusion about the figures. Some papers are reporting over 100. The ministry, permanent secretary in the Ministry of Health is reported to say only about 20-something. So could you give us what is the situation at the moment?
Okay, thanks, Chamberlain. I think the reason for the confusion in numbers is yellow fever presents like any other febrile illness. You know, it could be malaria, with typhoid fever, so any of the common causes of fever. So in the beginning, it's very difficult to say exactly how many people have this illness. But what we can say, in the last week, we have had 46 samples collected from patients that had symptoms of yellow fever, of which 13 were confirmed to be yellow fever. And of that 13, there have been 5 deaths. But it is still possible that among those not confirmed, some of them would have had yellow fever. So it's a complex business to give exact numbers during an ongoing outbreak. But the reality is there seems to be an ongoing outbreak. There is an ongoing outbreak of yellow fever in Katsina, and we're trying to work with the state government to respond to it.
So what is it? Which one did they refer to as strange illness as well?
So everything in Nigeria always starts as a strange illness. And that's something we've been working very hard to improve. Now, yellow fever, prior to 2016, there wasn't a single confirmed case of yellow fever in Nigeria for 17 years. That wasn't because there were no cases. That's because our laboratory diagnostic capacity was very poor. Our surveillance capacity was very poor. So we've been working in the Nigeria Center for Disease Control to improve these over the past 3 years. Now we have 6 labs functioning that can make that diagnosis in Nigeria. So what we're finding is we are finding more cases of infectious diseases. One of the reasons is that we're looking harder and we've improved our laboratory capacity. So rather than people die of mysterious illnesses or strange fever or complexes called malaria and typhoid, which basically doesn't exist, we're now able to say for sure they died of yellow fever or Lassa fever, and therefore that gives an impression that those diseases are increasing in Nigeria. The truth is these diseases are in our villages, are in our communities. We're beginning to find them, and at least the good thing that is now happening from these reports is that we are now increasingly aware of the challenge, and we have to then face the challenges in front of us.
Have you been able to track the root of these outbreaks that you call it?
Yeah, so yellow fever is really not a mystery. It's transmitted by a type of mosquito, similar to malaria, but a different type of mosquito that circulates more during the daytime. And you'll see from the reports that most of the people affected were farmers and people that work in the rural areas. And to stop transmission of the virus from the mosquito is very hard. So the strategy for yellow fever is actually vaccination. So if you receive a single shot of yellow fever, you're immunized for life. Now, you would see in the report that we did carry out with our colleagues at the National Primary Healthcare Development Agency that is responsible for vaccination in Nigeria, a campaign, a preventive campaign where everybody was, we target everyone in that state, actually was carried out in September this year. The challenge is that, you know, we had, or they recorded a coverage of 85%. So 85% of the target population was reached. So in the context of Zamfara, where our target population was just under 9 million, when you miss out 15%, it very easily comes to 1.5 million people that were not reached in a campaign that should reach them. So the part of Katsina that we're talking about is just by the border of Zamfara. The security situation is not optimal. So there are many challenges in terms of reaching every child. But what we will do with our colleagues at NPCD is find out exactly what is going on, probably carry out a catch-up catch-up campaign to reach the unreached. But I think the message for all Nigerians is, we wouldn't need campaigns if we took all our children to be immunized at the time they needed to be immunized. So for yellow fever, unlike Lassa, is not a disease we should be having because we actually have a very effective vaccine against it.
So what precisely is the plan right now? What is the risk for the rest of the country? If you already have specific areas where you're immunizing people and, sadly, the coverage is not even 100%, are there any other areas that are prone to this particular disease?
Yeah, so we've found sporadic cases of yellow fever across the country, and we've responded. And most of the time, once there's a campaign afterwards, we've managed to contain it. We had one in Edo, and just recently in Bauchi as well. So the challenge with yellow fever globally is there's a global shortage of vaccines. So whatever vaccines we have to use them very diligently. So our strategy, you asked for our strategy, like always, is to prevent, detect, and control. So we give messages, we use vaccination strategies to try and prevent. If that doesn't work, we pick up cases, and then, like in this case, there's an outbreak, then we will intensify our response in that specific area. And then, we treat the cases and hope to contain circulation. But for yellow fever specifically, it's very hard if you're not immunized to prevent transmission.
It's treatable.
It is treatable to some extent. There's no specific treatment for yellow fever. You treat the symptoms and most people would recover. But there's no antivirus that is specific for yellow fever that treats the virus. So once you are ill, you need to be managed very carefully, a bit like Lassa, manage your fluids, manage other symptoms, and you may recover. But most people would recover, actually, if we're treated.
So put us through this, because right now you're saying that these diseases will not come up if people will take their children for immunization. Are you saying that when children are immunized, they are immunized for life?
Yes.
Okay, because, we have a situation whereby when people go, there's some countries that request or require that you have the yellow fever card. And oftentimes, I don't know, I have immunized my child. I wasn't given a yellow fever card. I imagine that when she's older, maybe she has to travel somewhere that requires a yellow fever card and she's not sure. What then happens? Yeah,
so so it's important to also let Nigerians know it's the vaccine that prevents the illness, not the card, because many of us get the card without the vaccine. But having said that, if once your child is immunized and that is recorded on our childhood immunization card, once she grows up, she takes it to the authorities and that is signed off. The reason is previously we thought yellow fever, the vaccine only protects for about 10 years and then you had to get it over and over again. But over time, our research showed, global research, that nobody that had ever received the vaccine ever got reinfected. So globally, the WHO removed that restriction on 10 years. So right now, if the message is get vaccinated as a child, the vaccine is free for every child as part of the routine immunization schedule. As an adult, if you go to the ministries of health in Abuja or at the states, you can still get it for free as an adult if you're planning to travel. So these are the two strategies. But for yellow fever, vaccination is critical. And once you're vaccinated, you won't get the illness. So we continue to encourage all Nigerians to do
It's a big deal because you see that it has caused a diplomatic row. I think we had a row with South Africa some time ago when they were insisting that our citizens get yellow fever cards. In fact, it got so bad, I think they were, putting them on one corner and saying unless they took the immunization, they were not going to be let into their country. That's how big a row it's caused. And, you still have some countries who demand that if you're coming from Nigeria, you must have that yellow fever card. I know they were talking about people who have lost their lives, but these are some of the things people are simply not sure how it's supposed to work. And then sometimes when you actually do go and get the immunization, all you're given is the card. Is there anyone who is paying any attention to what happens at port control, that when people actually go to get immunized, they don't just give them the cards, they actually get the immunization?
Yeah, so it's very critical that Nigerians really understand how important this is, because very often we're careless with the most important things in life. So to be protected, you need to be vaccinated. And if you go to the airport, it always takes a conspiracy of two. Both the individual making the payment for a card without a shot and the healthcare worker offering the card without a shot. So we all need to get involved. We are in our country, we know how our country is and the challenges that we face. But really, the Port Health Services have been trying very hard. There's a new card just developed about a year ago that's a lot more secure and a lot less, not as easy to copy anymore. So every card can be traced to an individual. So even if you lose your card, your records are in the database, so it can be traced back to you and you can be issued a new card. So the federal government and the Ministry of Health, through the Port Health Services, is doing a lot on the card side and to ensure that that improves. But it really...
on the immunization side...
It takes all of us. Yes, the vaccines are there at the airport. You know, the truth is that once you get vaccinated, it actually takes 10 days for you to be fully immunized against the disease. So it doesn't have effect immediately. But still, it will protect you for every day of your life after the first 10 days.
But you mentioned a global shortage of the shots earlier. Has that been addressed in Nigeria?
Yeah, so the global shortage doesn't affect routine immunization. The global shortage is like when there's an outbreak in any part of Nigeria, we don't have access to millions of doses to then go and do a vaccination campaign immediately. We have to apply to a global stockpile and then hopefully get approved depending on the epidemiological situation, the number of people affected and dying and all of that. Make a case and then get a stock of vaccines. However, recently we have the National Primary Healthcare Development Agency has planned a series of preventive campaigns across the country. And this is really just to catch up on people that had lost or missed out on the initial opportunity for immunization.
You also referenced Lassa fever earlier, and from one of your situation reports, you know, chronicles that between January 1st and October 23 or thereabouts, there were some 400,000 cases recorded in 23 states of Nigeria. In which way are you working with the states to ensure that this doesn't get worse?
So thanks for that question. I mean, the states are actually the focus of almost all the work that we're doing. Yesterday, I was invited to the NEC meeting by His Excellency, the Vice President, with all the states in Nigeria to really discuss with them how to enable them take on their responsibilities a little bit more consistently. From the federal level, it's we are able to respond almost every week. We send a team from Abuja to one state or the other. But the truth is, it's a big and complex country. We cannot start the response from Abuja. So what we're encouraging all the states is to build up their own institutions to at least start the response and then call us to support. And many of them are taking more responsibility. I'd like to mention His Excellency, the Governor of Edo State. He is really taking on the challenge of Lassa fever in Edo and really put state resources around this response, and we're beginning to see results.
Yeah, well, especially because, according to from your report, 38% of all cases recorded is from Edo State, but then how is Ondo recording, which 31%?
Yeah, Ondo is the three states with the largest burden of Lassa in Nigeria, Edo, Ondo, and Ebonyi states. But we're beginning to see cases in other states as well. So these states, obviously, the more you are affected, the more you hopefully feel the pain. And the more you feel the pain, the more you're inclined to respond. So the governor of Edo has really been the forerunner. The other governors are also putting in some resources, but we use the example of Edo State when we go to the other state government to say, listen, see what His Excellency, the governor of Edo State, is doing.
How are we doing in terms of research, investing in vaccination, getting those here? Because, look, it's always a huge challenge, funding research and supporting your agency. What's happening with that?
Yeah, so this is critical for Lassa, actually. This year, we've been working with international collaborators for a few years around Lassa and trying to develop a vaccine. So this year, we're starting the first studies, preparatory studies for vaccine trials for Lassa, working with a partner called CEPI, which helps the innovation around vaccines for diseases for which there's no big commercial interest. So there's not a big commercial interest by the normal pharmaceutical companies and vaccine producers. So it has required a group of philanthropists, and CEPI has donor funds from philanthropists and some countries around the world to develop vaccines for diseases that sometimes we call orphan diseases because there's no commercial interest. So the first studies will be starting this year to define the burden around the three most affected states, because you can only test the vaccine where there are cases. If there are no cases, it's impossible to test whether it works or not, because we have to demonstrate that a new vaccine is able to prevent new cases from coming up. So that will start later this year. So there is hope, finally, after many years of really work. And it's incredible what the hope for a vaccine does for responders. The most at-risk people for diseases like vaccines are actually the healthcare workers in the front line. So the nurses and doctors that see that patient when she walks into the accident and emergency or hospital without knowing what they have. And sometimes we advise every doctor, every nurse to always use the personal protective equipment, gloves, gowns. But, sometimes they're short in the hospitals, and, you're faced with a situation between a patient dying in front of you and your skill. So very often, doctors have to make very difficult decisions. So with a vaccine in the horizon, it really gives them a lot of hope that, because once they're vaccinated, hopefully, it'll protect them. It shouldn't stop the use of PPEs, but it gives us one more tool in our arsenal.
Just wondering, though, so I know you already said that part of the reasons why we're discovering these diseases, they've always been there, is because you now have better labs in, across the different zones of the country. However, I wonder how, it hits your agency every time you see people dying of diseases that could have been prevented. What precisely is the strategy right now to ensure that this doesn't spread any further, and that this is contained, or that those who should be getting the education in the areas that have been affected have the education they need?
So, Apapa, this is the million-dollar question. For whatever challenges our country has, Mr. President has really shown commitment to the work NCDC does, and improved our funding a fair bit, albeit from a low base, and enabled us to recruit a few more people to do the very difficult work that we do. But the challenge is that there are some factors that are out of our control at the NCDC, where the country is growing at a population growth rate of about 3%. When there are more people living in the same geographical space, the likelihood of transmission of a virus from one to the other increases as the population increases. We've seen very challenging socioeconomic factors. The government is working very hard to manage those broader issues. In the short term, our role is to manage the complications of that, because infectious disease is really a complication of all the other factors. They're a little bit out of our control. So we continue to advocate to improve the resources that we have. We have a fairly small team of just over 200 people. We're working to support 200 million Nigerians, preventing transmission of infectious disease. So we're nowhere where we need to be. Investing in a place like NCDC is not the most politically attractive investment, because you can't show off a big infrastructure project. But the government has been very supportive so far. But we are growing incrementally. Science and knowledge is not something you can, grow overnight. So, but at NCDC, I'm very proud of the group of Nigerians that work 24/7 every day in the labs, in the surveillance department, to find these new cases, support the states in the response as rapidly as they can. Sometimes, depending on how proactive the state is, we're able to contain this to a few cases, and nobody ever hears. And so we're very often the victims of our own success. When we do well, there's nothing in the newspapers. In some cases like this, the news gets to us late. The places are the access challenges, security access challenges, distance, and then the spread continues for a while before we get involved. But generally, once we actually start a response like we're doing, I'm fairly confident we can contain the situation in Katsina State.
Is yellow fever infectious?
It's not infectious that you can't transmit from human to human directly, but if there's several people living in a context with those mosquitoes and the virus is already circulating among the mosquitoes, then several people can get infected by the same mosquitoes carrying the virus.
Whoa. So if it bites one person and then bites another,
Exactly.
and it goes that way.
Exactly. That's exactly how it happens.
It brings me to this difficult, situation. Of course, just as you said, you are victims of your own success, so to speak, and it's definitely a lot of work to do what you do already. But then, is there anything that can be done or is being done to sensitize people about these yellow fever and other strange diseases? There's even talk about Ebola and all of that. So which agency do you collaborate with for this enlightenment for people so that people can be prevented, or so that we can prevent rather than cure?
So we collaborate, thank you very much. We collaborate with many agencies on the federal level, but actually the biggest collaboration we have are with the state level organization. So what we do is we develop generic radio messages and TV spots. They would then translate this to the local languages and transmit in the state. So we make this freely available. We produce one part in Abuja here, and then we give it to the states, and then they will enable the transmission in the local TV and radio stations. But this is an ongoing challenge. We've increasingly used social media, just recognizing how many young Nigerians are on social media. So there's no perfect way of communicating to all Nigerians, but we have a very active website, one of the most active in public sector in Nigeria, where people go for information. We get millions of hits every week, people looking for information, depending on what is the topic of the week, whether it's Lassa or monkeypox or yellow fever. So there's no one medium that serves every part of the population, but we're increasingly trying to make sure we use all the media available to us.
That suggests that, it's been very, very responsive from the people.
It is responsive when there's a crisis. So when we see an outbreak of yellow fever and it's in the media and you're covering it on channels, yes, we get lots of hits, which is why we actually take opportunities like this very seriously. There are lots of things every ordinary Nigerian can do to prevent the transmission of infectious disease. Immunize your child. Keep your environment hygienic, take your refuse away, wash your hands after using the bathroom, before eating. In fact, wash your hands as often as possible. There's no harm in doing so. So there's a lot that every Nigerian can do themselves in preventing transmission, while we work on the more difficult things like developing vaccines.
Well, I was just going to ask you, how do you feel? Only recently, I think it was on Sunday, I know that this is almost political, but when people actually do put their lives on the line, your men, the people who work with you, men and women who work with the NCDC, put their lives on the line almost on a daily basis, developing, redoing research, going to frontline states and things of the sort. Only recently, I think on Sunday, Dr. Stella Dadevo would have been 63, and they're talking about giving our honor to whom honor is due. How does this hit your agency, or you personally? How do you feel about, calls for her to be honored?
So, thank you very much. I think the work that Stella, Dr. Dadevo, and actually 3 other healthcare workers, because we tend not to mention them a lot. There were 4 healthcare workers that died in that outbreak. is so important for all of us and the work that we do. Healthcare workers, we've lost quite a number before and after, but her work really symbolizes the work of everyone else. And I am sure that the federal government is planning an appropriate honor for her. I think we have a listening president. I'm sure he has heard the cries of Nigerians. Very often, our president doesn't act immediately, people shout. He'll take his time, but I'm absolutely sure that honor will come to her. And we can all celebrate the work that she did. Celebrate in a good way. And the best celebration, actually, of Dr. Dadevo's work has been the establishment of the Nigeria Center for Disease Control, the growth of the work we do, the realization of how important it is for Nigerians. But it's not just NCDC, it's the nurses, the doctors, and all of them that wait for patients as they come in and deal with them on a daily basis.
Well, we kind of wish you well. Dr. Chikwe Hekwazu, the Director General, Nigeria Center for Disease Control. Well done, and all the best. Whichever way the media can help, we'll always be here to do that, to save lives. Well, back in a moment. Stay with us.